Hello, 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 my friends. Jill Osborne, Interstitial Cystitis Network. Hold on, gotta get my camera fixed for YouTube here. All right, that's a little bit better. It is Sunday, January 22nd. It is time for another live support group meeting. I've got the rents taken care of. The 100-year-old is sleeping in the family room in the recliner. The 94-year-old, soon to be 94-year-old, is now eating her Norwegian fruit soup and toast or fiber bread with cream cheese. It's crazy to think, it's amazing how your life changes when you're caregiving, right? Hello, and what are oxalates? An oxalate is a crystal. It occurs when foods are digested, but there are some foods that are just high in oxalates, such as spinach, chocolate, berries. And because it's a crystal, as it collects in your urine, it has the potential of irritating tissue. And so oxalates are associated with oxalate kidney stones. Oxalates are already also associated with vulvodynia for some people. Oh, hold on. Facebook has no voice. Hold on. I swear I just checked it. Audio, Scarlett. You should have audio. Can you hear me on Facebook? Boria, can you hear me on Facebook? We're having some audio sounds. Hello, YouTube. Hi, YouTube. Gay says she does have voice. Excellent. Oh, the joys of technology. Not. So anyway, it was the Vulvar Pain Foundation that, is it the Vulvar Pain Foundation or there are two different vulvodynia groups. One is large, one is small. It was a smaller one who made the connection with oxalates, and they have a low oxalate cookbook. And our original IC book, A Taste of the Good Life by Bev Lamott, actually talked about oxalates and broke out recipes based upon oxalates. So oxalates are real. But they don't really bother a lot of people. But there's always a chance that it might bother you. My mother is extremely sensitive to oxalates. I am not sensitive to oxalates. So go figure, right? Go figure. So got hello, I think Rhonda, that's you. Is that you on Facebook? I mean on YouTube? Nice to see you. So normally when I do these meetings, I do a 30-minute like little intro, educational intro. Then we take your questions. We go as long as y'all want to go, and as long as my voice survives. My voice is definitely a little bit funky. My tonsils are just very red, and they have been for some time. And of course, my purpose in doing these meetings is I want to empower you. I want to make you stronger. I want you to know, like legitimately, you're not alone. That we're here, that there are people standing beside you, behind you, with our hands held out to give you love and comfort and support, because working together, we truly, truly will get through this. There is hope. And it's interesting when I work with patients on the phone, and I've had so many interesting phone calls. And for those of you on Facebook, you're going, hey, where's Jill? Didn't she do a drop-in meeting on Thursday or Friday? Yeah, no. I was doing coaching, lots and lots and lots of coaching this week. And a couple of them were really interesting. I spent 2 hours with one sweet lady who called, who was really, really struggling. And if you're watching, just know I'm saying this with love and kindness and support, but we also want to teach others. So in her case, she had been struggling with IC for about 10 years or so. She was in her early 50s. It started in her early 40s. And she was kind of flailing, for lack of a better term. She was just grabbing whatever she could grab onto to help, right? And so she was considering Botox, and she was considering this, and she was considering that. But she'd never really thought about cause. And it's like, okay, so what are we saying now? We don't want you to chase your symptoms. We want to focus on trying to fix the underlying cause. And for those of you, I don't know what's going on Facebook here. If you could share this, that would be great. I don't quite understand what's going on with Facebook, but anyway. So, she had really struggling with symptoms, not sleeping well, struggling with pain every single day. The pain was not going away. And so I think I was the first to ever really talk to her about the concept of cause versus effect. And like trying to understand why her symptoms began in the first place, and specifically, why was she flaring now? So her case was actually a really easy case to start with, because she admitted that she was drinking a massive amount of coffee. Her favorite drink was Diet Dr. Pepper. And as I went through kind of our subtypes, the subtype that really jumped out for her was, in fact, chemical irritation of the bladder wall. Her diet was absolutely terrible. So she eventually learned about diet, yada, 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 started some therapies. But here's the rub. 10 years later, really struggling with symptoms. Why? Well, so she confirmed, and her doctors absolutely confirmed, that she had severe estrogen atrophy. So we know she's bladder wall driven, and we have to really work with trying to improve the quality and health of her skin, right? So that was easy. Hi, Caroline from England. Yeah, I'm pretty good overall, pretty good, except for this whole throat thing that comes and goes all the time. But why is she flaring now? So she said she'd been on the diet. She'd been following the diet to the T. And again, all of her conversations with her doctor were about treatments. And it's like, well, come on now. Let's just make sure. Let's just make sure that we understand what's driving these symptoms. So we went through kind of the basics, like, okay, are you following the IC diet? Yeah, definitely. I'm not drinking coffee. I'm not drinking soda. I'm like, okay. And I kind of go through my list of things. And, I always say, you guys are like, it's like pulling a needle out of a haystack for some of you. And some of you are very resistant. You're very, very, very resistant to give me the full piece of the puzzle, the picture of the puzzle, or all the pieces of the puzzle. So anyway, we do this big long discussion, then we go into pelvic floor, and it's like, have you had a pelvic floor assessment? She said, no. It's like, do you have tight muscles? Yeah, she definitely had tight muscles. So it's her up to pelvic floor. But that doesn't really explain why is her bladder wall screaming at her. And it's like, I keep going back to that. It's like, okay, but this flare, this is a really weird flare. You're in pain every day, all day. Why? And I go back to bladder wall over and over and over again. And she goes, well, I have to drink at night. I got to have my 3 drinks at night. I have to have my cocktail at night. And she kept saying that over and over and over. I have to have my cocktail. And it's like, okay, but now, okay, I think we have a very clear understanding now of why your bladder's screaming at you. Because your bladder can't defend itself because you are now in severe estrogen atrophy. And you're pouring not just one alcohol, you're pouring alcohol in it every single night, multiple times a night. Do you understand the damage that that's doing? And she's like, but I have to have my alcohol. I have to have it. And it's like, okay, if you had a wound on your hand that's open, would you pour alcohol on it? She goes, no. And I said, well, what do you think would happen if you poured alcohol on it every single day? And she goes, oh, it would probably hurt. And I'm like, well, that's exactly what you're doing to your bladder. And she's like, but I have to have my alcohol. And that's when I just got real blunt. And I said, hun, are you an alcoholic? I said, it kind of sounds like you're very dependent on alcohol. Are you an alcoholic? And she pretty much confirmed that. And so, you know, I always get to have awkward, difficult conversations with people. And my job is to say it with love and with kindness and with compassion, and really to try to help you understand cause and effect, right? That when you have an injured bladder wall and you pour alcohol on it, the bladder wall is going to hurt. Will that bladder wall heal? No. And because she'd been drinking for a long time, I think that is probably why she suffered with severe pain for 10 years. And now it's going to be up to her to get the help that she needs. And we talked about that, so that we can try to reduce this alcohol irritation. And she said, well, is there any treatment I can take and still drink my alcohol? And I went, no. There's no treatment that will counteract the damage that the alcohol will do in your bladder, just like there's no treatment that will counteract the damage of drinking diet soda every day. You have a wound. Your job, your obligation is to create an environment that will help that wound heal. So that was one very interesting conversation that I had. Then I had a young man call who, his case was very interesting. And you guys remember, I'm not a doctor. I'm a support group leader. I'm a coach. I don't give you medical advice. My job is to educate you, inform you, give you a new set of questions, and kick you in the butt and get you back to your doctor, right? So you can ask your doctor questions. Hello, Elise. Nice to see you, hon. Nice to see you. So then I had another case of a young man who called who was using ketamine. And he was using, his doctor had prescribed ketamine for depression, and he developed some pretty severe bladder symptoms, right? You can see I'm a little dehydrated. So I got to keep my drinking. You can see my fingers are pickled, right? So anyway, he was using ketamine and he started having a lot of bladder irritation. And it was kind of the same thing. He's like, but I really like my ketamine. And it's like, yeah, but ketamine is corrosive to the bladder wall. But what was so interesting about him, you know, because again, remember the bladder only knows one language: frequency, urgency, pressure, pain. So all of your symptoms are very easy to associate with UTI. And in his case, he kept associating his symptoms with ketamine. And the ketamine certainly was not good. But again, we go back in time with him and go, okay, when did your symptoms start? In his 20s. Do you remember anything that happened? Was there any trauma? And he goes, yes. He had a bad accident lifting weights at his gym. He was powerlifting and he strained his pelvis and he had coccyx pain, pelvic pain. And it's like, oh, light bulb. And he's like, you know, I told people about it, but nobody cared. And it eventually went away. And it's like, well, yeah, probably. Yeah, the pain might have gone away, but I think you did something to your muscles. And, you know, he had some of the other symptoms we associate with muscles: difficult starting a urine stream, pain after urination, pain with movement, right? So in his case, even though he was absolutely convinced it was a ketamine, I was like going, I don't think so. I think the ketamine is making it worse for sure. But you have pain when you lift weights. And you suffered a bad accident that hurt your tailbone. And I sent him off the pelvic floor. It's like, okay, let us just take a step back here. revisit the diagnosis and get him off to have a proper diagnostic workup with a pelvic floor assessment. Danielle says, thank you, Natalie. Danielle says, I've been feeling so dark that I don't want to be here anymore. I had surgery for hysterectomy that turned into a bladder fix as well. And the pain feels like I have a blowtorch underneath my, oh, honey. Can you see this? I'm holding your cheeks right now, and I'm looking you right in the eye and go, you got this, girl. You are not alone, my friend. Danielle, you can do it. You can do it. We have been there. We have been there. This is a hug. These are our hugs now. So big. Number one, guys, everybody, please send a big giant hug to Danielle on YouTube. Girl, she is post-hysterectomy. We know how hard hysterectomy is. I have been there. I know how hard it is. And Danielle, if you're feeling that way, you deserve the best care available. And I am not the best care for that. If you're feeling suicidal, I need you to call your suicide hotline, 1-800-SUICIDE, because they are experts and they know all the resources in your area, and they do this every single day. And so I want to support you. I want to hug you. I want to give you strength. I want to give you confidence. I want to give you power, and I want to give you a good direction to go in, honey. I need you to get, and that means that when you're having these really, really, really dark thoughts, open the windows, get out in the sun, let the sun ease your brain, let your sun ease your body a little bit when you can. Pick up the phone, call your doctor, let them know how you're feeling. And if you need to, call your local suicide hotline, okay? Now, here's the deal. There's a fabulous website called Hyster Sisters. It's where women go who are considering hysterectomy, have had a hysterectomy, or getting support for their hysterectomy, especially post-hysterectomy. They have this fabulous support community with hundreds of thousands of members. And that's where I went after mine, because I suffered a rare post-hysterectomy adverse event. And Danielle says, I really appreciate that. And I'm fighting the fight. Girl, this is one of the reasons why I'm wearing pink today. This is my favorite happy color. And I've got this great mug coming that says, you can't wait until life isn't hard to be happy. Sometimes we have to be happy even during those hard moments. And we each have our own story. We each have our own journey. We each have very, very, very difficult moments. Like my mother is now, when she goes to sleep at night, is hearing a man singing to her. And she keeps asking me, do you hear him? And I'm like, no. And I just keep telling her it's an angel singing to her, because she's very old and very frail. So we all have those dark moments. But the sun rises every day. There are people who love you, people here who care for you, and people here who have walked in that journey and can share some insight for you. So Hyster Sisters is incredible. Danielle said, thank you so much. You are an angel, and I've been watching your videos for a while. This is my first live. I have so many, the first time that I had so many supportive people. Good. Okay, so now listen, hysterectomy. We got to talk about hysterectomy for a moment. You got to understand that doctors, you know how you go to a doctor and they go, well, let's do this. Oh, it's not going to hurt that bad. You'll be fine, right? And so you go into a surgery thinking, yeah, piece of cake, not going to be a problem. Everybody does good. And then bam, guess what? Whoa, wait. Holy hell, I can't even have a bowel movement without bawling my eyes out after hysterectomy, right? And it's on one hand, you can see why doctors do that, because they don't want you to presume that it's going to be bad and then create a self-fulfilling prophecy. But on the other hand, you're not accurately prepared. You're not accurately prepared for the challenges of recovering from hysterectomy. Hysterectomy is one of the biggest surgeries a woman can have. I was working with a lady again this week who had, Renee says, what a joke. Hysterectomy ain't no joke. Exactly. Hysterectomy ain't no joke. And number one, it depends on how they do it. They can do abdominal incision or vaginal. If they do an abdominal incision, they can do a bikini line, or they can do a vertical. I was working with a lady who had 3 vertical surgeries this week, and she'd never had a pelvic floor assessment. It's shocking. Teresa here on YouTube says, I was 33 when I had a full hysterectomy. Now you're dealing with IC. Natalie said, my poor mother had a full hysterectomy in the early 2000s. She was cut clearly across her stomach and she had over 30 staples. Exactly. Now, I had a total vaginal hysterectomy. So what that means is that I had 3 or 4 little tiny incisions on my belly, and they stuck instruments in there. They put light in there. They put some air in there to open things up. And then they had, I don't know what they used, a cutter of some type, but it might have been heat. I'm not sure exactly how they did it. So anyway, what they do is they disconnect everything through these little tiny incisions on your belly. And then where your cervix used to be, they basically cut a loop and they pull it all out in one piece. Well, they try to pull it out in one piece. In my case, they didn't do that. In my case, they tore my vagina. Of course, they didn't tell me they tore my vagina until months afterwards. And so here I am at home, and the other thing that's crazy about hysterectomy, seriously, I was home 3 hours later. Like, what the hell? I was literally, I was in the car 90 minutes after my surgery. Easy. And I remember waking up in the recovery room, and the nurse goes, hey, you got to get up. Time to go home. Let's put your clothes on. And I'm like going, no. And I rolled over. It's like, leave me alone. Right? 15 minutes later, she comes right back up. Jill, come on, Jill. You got to get up. We got to get ready to go home. And I'm just like, oh, whoa. And she goes, well, let's go to the bathroom. Oh, that was a trick. And I'm laying there going, okay, I could go to the bathroom. So, you kind of go, oh, and you get up the bed and you're going, and you got your hands on your belly and you're walking like a 100-year-old person to the bathroom, and she's going beside you. And it's like, okay, I don't know. And then they get you in there and they sit you on the toilet. And before you know it, they've ripped off your gown and they put your dress over your head. Damn sneaky. I'm like going, wait, what? She goes, you got to go home. We're getting ready to go home. We called your sister. She's going to come pick you up. So, and I was just in the car and trying not to throw up in the car. And we get home and I shuffle in and my parents look at me and it's like, just leave me alone. I got to lay down. Just leave me alone. Right. You can laugh about it afterwards. And girl, you're going to have funny stories to share about this. But in all seriousness, here's what happened. So about 6 weeks into surgery, post-surgery, I bent over to pick up a shirt off the floor and I ruptured I broke a stitch. And it's very important with hysterectomy that you follow their post-op recovery. You do not lift anything for like 6 months. Nothing. And I was out pulling weeds like 5 days later, which was really stupid. And I ended up with this pulling sensation. I know Becky says it doesn't seem so funny to me. Sometimes I feel like I hate doctors and other hospital staff. Oh, it's a love-hate relationship, right? So eventually I started feeling like there was this hand up inside my vagina that was grabbing onto where my cervix was and trying to pull it out of my body. Is this pulling sensation, this weird pulling sensation. And I'm like emailing my doctor because it really kicked in at like 2 months afterwards, 6 weeks, 2 months afterwards. I'm emailing my doctor going, what is this pain? I do not like this. What is this? Please tell me what this is. I need help. And they're like, Jill, you still have sutures in you. They're 90-day sutures. You're still fresh from surgery. You got to rest. Don't do anything. Yada, yada, yada. Well, 10 months later, I was still having it. And basically, Danielle, what I was having was involuntary muscle spasms. I was having involuntary levator ani spasms, which was really just from the trauma of the surgery. And with a little physical therapy, it went away. So, yeah, got to be the squeaky wheel. You got to let your doctor know what happened, what you're feeling, and ask for help. Now, she says here, hold on a sec. So, hold on a sec. She had a laparoscopic surgery. That's exactly what I had. How long ago did you have it, Danielle? It's she stayed. Whoa. Oh, you had it in December 2020 during the thick of COVID, but you were in the hospital for 3 days? Why? Why were you in the hospital for 3 days? Rhonda says, when I had my partial hysterectomy about 17 years ago, they kept me overnight. Luckily, I only had 3 tiny places, but oh boy, did it hurt. I still had 3 small kids back then to care for. Yeah. It's kind of like recovering from gallbladder surgery. They don't tell you when you have your gallbladder out how hard that is. Sue says, if you tell them you can't control your pain, they can't send you home that quick. I found that out after multiple procedures. Girl, I didn't even have pain meds. I mean, I had them at home. During my pre-op with my gynecologist, because remember, they thought that I had uterine cancer, and I did have very, very, very early uterine cancer that we caught in time, right? So thank God that we did that, but it was a traumatic nonetheless. But when I had my pre-op appointment, I was really clear with my gynecologist. I said, I will not do surgery unless you give me pain meds ahead of time. I want the prescription now. I'm going to fill it now so that when I get home, it is in my bedside table waiting for me. I'm not going to trust the hospital. And I'm sorry, I'm not going to trust your team to give me the pain meds at the hospital, because you hear too many stories of people being sent home from surgery without pain care. And it's like, no, that's my hard line for me personally. So Danielle, again, why were you in the hospital for 3 days if you had a laparoscopic surgery? Hold on a second. Let me go back here. Did you say that they hit your bladder? You had a bladder fix as well. And the pain feels like I have a blowtorch underneath my. So what did they do to your bladder? Did they do like a suspension surgery? Did they do a bladder lift? Or did they cut your bladder in some way? Tell us a little bit more about that, girl. Tell us a little bit more about that. Dan says yours was not laparoscopy, yours was abdominal. Okay, that helps. That explains why you might have been in the hospital at least one night. But why were you in the hospital for 3 nights? I mean, that's pretty unusual. That means that you were experiencing some sort of complication, or you had a much more invasive surgery than they originally intended. Natalie says, what's the best way for me to find a urologist in my Arizona area? You're going to have to call their offices. you're just going to have to call their offices, hon, and just say, listen, I got Hunner's lesions that I need treated. I'm looking for a steroid injection, or I'm looking for laser therapy, something like that. Do you do that? But we also want to make sure, we also want to rule out other potential causes for Hunner's lesions, like posterior fornix syndrome. Donna says, regarding Peora Poly 500, how many milligrams can you have in one day? Is 1 or 2 capsules 500 milligrams? I need you to Google it and look at the research, and you can look at that yourself. Palmitoyl ethanolamide. I know that for Peora, see, is this not like one of the happiest things you could wear on a beautiful blue sky sunny day? So for Peora, which is a supplement created by Natural Approach Nutrition, they do, it looks like, well, they don't give the actual amount because it's a proprietary formula, but it looks like it's probably about 1,000 milligrams a day. Peora, ideal for somebody who has more nerve-driven pain, according to the research. Palm says, I just read that Desert Harvest is going for FDA approval for their aloe caps. I just started them and noticed a huge improvement. Good. I don't know what the company's doing. We don't work with that company so much because it changed hands. We sold Desert Harvest aloe for over 20 years. It's a solid product, just like aloe can soothe the sunburn on your skin. Aloe can also potentially soothe an irritated bladder. Is it going to repair damage? I don't believe so, because the human bladder does not have aloe in it. Aloe is a plant material, but it certainly has the potential of calming and soothing the bladder wall. So you kind of have to look at methods of action. If you need to calm and soothe, then aloe is a great choice. If we're trying to help coat the bladder, I personally put chondroitin first, because chondroitin is found in the bladder wall. Hyaluronate is found in the bladder wall. But for some people, aloe works great, so go for it. Donna says, just as for a small flare, should I take Peora or Allopath? Allopath. Palm says, how many milligrams? I don't know what you're asking. How many milligrams of what? I just know that I'm a less is more person. I personally, because I'm IC subtype 5 central sensitization, I'm sensitive to stuff. I'm sensitive to just a massive amount of things. So I never take a lot of anything. I always start with the lowest dose of whatever it is and slowly titrate myself up to see if I can go up. But there are a number of patients who, for example, with Cysto Protect, the manufacturer recommends 4 a day. I could not get to 4 a day. It gave me loose bowel, but I was able to take 1 a day. But 2 a day, 3 a day, and certainly 4 a day pushed me way over into bowel irritation. So it's about finding the dose that works for your unique body. Danielle said, they told me due to my C-section in 1993, the scar tissue cut into my bladder. Holy crap, Danielle. Wow, you're actually not the first person that's happened to. So, so Danielle, again, is post-hysterectomy, struggling with a lot of pain. She had a C-section in 1993, and for somehow the scar tissue from the C-section got into your bladder. I think really what they're saying is that when they did the C-section, your bladder wall was cut. And so it was leaking urine inside your body, which is what made it not so easy hysterectomy. Well, thank God they did the hysterectomy and found it, right? Thank God they found it. The question now is we have to try to figure out, why are you struggling with such severe pain? Danielle, I'd love to talk to you, offline. If you're around this week, please give me a phone call. I'd love to talk to you. Um, I would really want to know kind of what part, where in your bladder was this? Was it in the trigone? Was it high? Was it low? And then it sounds like they might have even had to resect your bladder or to cut out scar tissue and then sew it up again. Is that what they did? Rhonda says, great advice with surgeries. Also recommend doing this. Hi, Sue. Renee says her bladder was scarred to her uterus. That's actually quite common. Hold on a sec. Donna says, would it make sense for bladder rest daily to add aloe? No, again, the allopath to me would be a better choice because it has the soothing effect of the aloe combined with the nerve calming effect of the PEA. And it sounds like we got some nerve stuff going on. And Danielle says, absolutely. Thank God they found it. So we have another member who had been in a car accident when she was quite young, in her early teens, and it too ruptured her bladder, but they didn't know her bladder was ruptured. And for about 10 years, urine was leaking into her belly, and they were telling her she was emotional, it was puberty, all this sort of crap. And I talked to her when she was like 21 or 22. And I got to tell you, she was hysterical. And there was a part of my brain that was going, okay, wow, she is really hysterical. Is there a mental thing going on, or is there something else going on? Well, they did a laparotomy and her bladder had been destroyed by the car accident. There was no saving it. And so they pulled it out. They did a cystectomy. And that was the start of her healing journey. And that was a tragic lesson in how children are not listened to, how teens are not listened to, how there is a perception that a girl in pain is mental, is emotional. We have all been there. And thank God they found it. So Danielle, I'm so glad they found it for you too. Oh, your bladder had to be put to sleep for 6 months, so you wore a Foley on your leg. Oh my God. Girl, how old were you when this happened? You are a warrior. You embrace your strength. You have gotten through all this and you are here today sharing your story and potentially helping others. Girl, you are a tough bitch in the best possible way. I say that in the best possible way. W. Marco says, I had my fulguration a few months ago and I'm doing better with my Hunner's lesions. Yes. I am having a trend of waking in the morning with severe bladder pain. It will only go away after drinking water. Well, when you're asleep, your urine gets very concentrated and your bladder is probably still sensitive. The nerves in your bladder are probably still sensitive. So that concentrated urine is tweaking you. Okay, hold on a sec. Sue said something here. Sue said, if you can't control your pain, if you tell them you can't control your pain, they can't send you home that quick. Nobody even asked me about my pain with mine. She couldn't even empty her bladder by herself for almost 3 days. And she was in the hospital for 3 days, but I also had a bladder sling. Well, you had the sling and you had the pelvic floor reconstruction, and it was an 8-hour surgery. So thank God you were in the hospital. Sue, great advice, girl. Great advice. Danielle was 47. Don't think of yourself as a victim. Think of yourself as a warrior, because you truly are a warrior. You have gone through all of that, and you're here to tell about it. And I firmly believe that there is one gift in this, and that one gift is that we will never, ever, ever walk away from a family member or a friend in pain, because we know what it's like to suffer alone. And Donna, there is going to be somebody that you are going to help so profoundly because of your experience today. And so, you just never know. Sharon says, do trigger point injections, which I think are referred to as pelvic peripheral nerve blocks, help with urinary frequency, or are they used only for pain? Well, they're actually used to resolve a trigger point. A trigger point injection, what it does is it numbs this tight muscle knot so that they can release that tight muscle knot. And hopefully by releasing that muscle knot, you will have less pain. And we will have good blood supply because we now have a normal functioning muscle rather than a muscle that's all in knots, right? Pursuit says, how are you? We'll never stop thanking you. I feel so blessed with your guidance. You stopped the cystopen, still following diet and pelvic floor. I am good, except I have, I remember 2 weeks ago, well, you probably couldn't hear it in the meeting, my first meeting of the year. My throat started getting really thick, and it was my tonsils. And a couple of times a year, what happens is I get this chronic tonsillitis, which I have again. So I'm having to kind of force my voice over my tonsils. They're red with white spots on it, but it's not strep. And I don't have fever, and I don't have anything else. It just is what it is. And I also have a canker sore on the roof of my mouth from sucking on a freaking throat drop, which then swelled up a big giant lymph node here, which is now going down. Life is just, come on, a resolution for this year is no health stuff. No health stuff. Come on, I want a month with nothing. How about 6 months? Nothing. Can we just have normal bowel movements, normal bladder stuff, normal periods, just a happy, healthy life where we can just sit back and relax and breathe, right? Okay, so I got a couple of things I got to talk to you about. Number one, I signed confidentiality agreement, so I can't say much. We are going to have some really exciting clinical trial announcements in the next couple of months. New treatments, very promising, very encouraging. Now, what is a clinical trial? A clinical trial is where they're creating the data that they need to get FDA approval. So they start with animal studies. They do a lot of toxicity studies that way, and then they move over into humans, and there are different phases. And once we get to the human level testing, one of the first things they do is they're just establishing dosing, side effects, and then they're finessing it, stuff like that. And ultimately, in the end, participating in a clinical trial is a tremendous gift that you give to your brothers and sisters with IC, because that's how we find new meds. And so hopefully you're already getting our newsletter. Make sure you come on over to the IC Network website, sign up for the IC Network newsletter. If you're on Facebook, there's a button right on our Facebook page to do that, because that's how I send these out. And I'm telling you, these are super, super encouraging. I'm thrilled with what I'm seeing. Man, that IC research movement is alive and well and kicking butt in the best possible way. Anne says, Orabase is good. Yeah, I use it. I also rinse my mouth out with lysine, which works. The second advantage of participating in a clinical trial is that it's free medical care. And so for those of you who are financially challenged and you would love to get medical care, but you just don't have insurance or the insurance won't cover something, they will cover your testing, they will cover your treatment and follow-up care as part of the study. And so that's also quite compelling. And it's also a very good way of actually getting in the door of some clinics. Like if you're up in Canada, it was very hard to get into Curtis Nichol's clinic, and we'll come back to Curtis Nichol because something else is very exciting is happening. That was one way to get in the door to see some of these top-notch national specialists. And they may pay you. And at least one clinical trial would be doing is actually going to pay patients for participating. So I want you to look out for those. Some of them I'll be able to talk about in chat. Others I will not. It will only be the blast email because there's all sorts of proprietary stuff going on. So please make sure you come on over to the IC Network and you sign up for our newsletter so that you can get those, okay? Danielle says, just to let you know, I had a friend that had tonsil pearls. They look like a little pearl stuck in the back of your throat, and you can wash them out with a Q-tip and Listerine. You know, I don't. It's not that. It's not. I know what those are, and they taste terrible when they come out. Thank you, though. It's just I sleep in a room with a lot of books. There's a lot of dust, a lot of allergies. Because I can't sleep in my bedroom right now. I'm sleeping in my family room in a recliner because my freaking TMJ. I can't lay in my bed. I haven't laid in my bed in 3 years. My bed was my safe place, and it's very annoying that I can't sleep in my bed. We'll get there. Okay, so that's one thing. Clinical trials, clinical trials. When it comes out, I need you to share it with a lot of people because if we can just help one person get better, that's a good thing, right? If you can look yourself in the mirror at the end of the day and go, I helped one person that day, then that, my friend, is a very, very, very good day. Now, Curtis Nichol, best writer in the IC world from a research standpoint, by far. He was the top IC researcher in Canada. So good, the U.S. government paid him. Right? And hi, let's see. Thank you, Natalie. Natalie's asking how my dad is. He's asleep. He was asleep in the recliner when I started. He's 100 years old in 2 months. We'll see. Anyway, Curtis Nichol has given us a gem, and I will be giving you guys the links to this. This is fascinating. Managing IC in female patients, clinical recipes for success. Okay, so number one. Now y'all remember that we are practicing precision medicine, cause versus effect. We don't want to waste time chasing your symptoms without addressing underlying cause, correct? Correct. We want to fix the underlying problem so you don't have symptoms in the first place. How do we do that? We do that with subtypes. Now, 3 years ago, when we released our book, IC 101, it's not just a bladder disease. Doctors were like, oh, who the hell is the IC Network? What do they know? Well, number one, we're rated number 1 in the world by Harvard. Yeah. I'm published by Harvard. Yeah. Everybody's on the bandwagon. Everybody now clearly understands there's subtypes. And we don't want to waste time doing bladder therapies if you have a healthy bladder wall, for God's sake. If you have a cystoscopy or a hydrodistension with cystoscopy and you have a normal bladder, then you have a normal bladder. This is great. Now we got to look outside the bladder and figure out what the hell is wrong. We do that with subtyping. So I use the Chris Payne system, Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, central sensitization. 5 core subtypes, right? We've been using that. In fact, I just sent Chris an email about this, thanking him because he's retired now. Because we have used that so successfully in coaching now. We've helped so many patients. Thousands of patients have been helped by understanding this concept of cause versus effect. Well, Curtis Nickel, again, the best writer, in my opinion, I read everything he produces, has created clinical recipes for treatment based upon phenotype subtypes. Okay, this is great. But what's interesting here, okay, I just want to go through some of this stuff. I haven't even had time to write an article on this yet. Okay, so here are these are the subtypes that he's using. So, okay, hold on. How many? 1, 2, 3, 4, 5, 6, 7, 8, 9. He has 9 subtypes. Number 1, inflammatory IC, bladder wall inflammation and or Hunner's lesions. Okay, so that's the same. Number 2, now this is new, infection-mediated IC with a past history or currently experiencing recurring UTI. Now, in our guidelines, if you have an active UTI, you're excluded from a diagnosis of IC here in the United States. But this is real. We've talked about this. This is part of bladder wall driven, that yes, you could have chronic UTI. The question is what type of UTI, because it's not always bacteria. It could be fungus or it could be virus like COVID. Third subtype, hypersensitivity. Chris Payne's IC subtype 5. Now, this is interesting. I want to read this to you. Hypersensitivity subtype. Mucosal, so your bladder wall mucus, neuropathic upregulation, typically associated with a central sensitization causing pain outside of the pelvis, widespread pain. So in other words, chronic overlapping pain conditions. So Chris Payne's IC subtype 5. Another subtype, allergy subtypes. These patients have multiple allergies, including respiratory, environmental, dietary allergic history. Mucosal wheal and flare. Mucosal wheal and flare with provocative cystoscopic testing. So think about this for a moment. Think about what like I have out in my yard oxalis. And if I pull it without gloves on, I break out in a rash. And man, that sucker itches for a week. Some people are fine with oxalis. I'm not fine. My yard is full of oxalis right now. So what happens if you have an allergy that causes a reaction in your bladder wall? Could you have the equivalent of a rash in your bladder wall because you're being exposed to an allergen? Okay, fascinating. Another subtype, pelvic floor pain. Okay, we know that. Here's one. So there's 3 more. Primary storage symptoms. The dominant symptom is urinary urgency and frequency associated with bladder pain. I'm going to have to read more about that. I'm not sure about that. Another subtype, associated sexual pain, vaginal, vulvar, bladder, and or pelvic floor pain associated with sexual activity, and flares. Okay, so what's most exciting about this, kind of at first glance, is the allergy subtype and the infection subtype. This is cool. Amy says, I'm listening but driving to Irvine. Okay. Let me see here. Hold on a sec. He describes the subtypes in depth. Oh, and another subtype, urethral syndrome. Localized urethral pain can be the only symptom, but it's usually associated with other bladder pain symptoms such as voiding and sacs. Dude. But he also does not mention pudendal neuralgia, which I think is a subtype. And that's what Chris Payne said when he came up with this system is, you know, there are going to be more. And as Palm says here on YouTube, what about autoimmune? That is a subtype. That has to be a subtype. For those patients who have lupus, for those patients who have Sjogren's syndrome, who have IC, it's a tiny subtype, maybe 3%, but that is a very clear subtype. Also, And we also have to look at Lyme disease. Lyme disease, because many patients with active Lyme disease have bladder symptoms. And of course, we have this whole new COVID cystitis now. There's going to be thousands, tens of thousands of patients diagnosed with IC who actually have COVID cystitis. Okay, so anyway, I'm going to do a big article on this because this is just fantastic. Fantastic, fantastic, fantastic. And so he has recipes on how to treat each subtype. And so, hold on a sec. What did I do with this? Curtis Nickel, I'm going to send him an email. Like, dude, I said this to a pharmaceutical executive that on Friday, I called him up and I was like, dude, this is fantastic. I think in his brain he was going, California girl. That's okay. When I'm excited, I say dude. Okay, so hold on a second. 1, 2. Okay, where's my page 395? Where did it go? 396, 397, 398. There it is, 395. So the other thing about this is he talks about the recipe. What are the recipes? What's the treatment plan? Becky, you're right. Many of us have more than one subtype. It's true. Okay. So again, he's creating this with a model that's very easy for all of us to understand, and that is, let's create a recipe for success. So here is his recipe for success. Number 1, education. Patients should be reassured that they have a very specific diagnosis and that the symptoms of IC are significantly impacting their life. They must understand that physicians do not have all the answers, but they need to be a part of the solution. They must start their mindset with that the glass is half full, and that's very, very true. Number 2, the second ingredient in his recipe is diet. Diet manipulation using a recognized elimination diet can be attempted. The idea is to eliminate all combustibles. Why does he call it combustibles? Such as coffee, tea, soda, fruit juice, chocolate, alcohol, nuts, spices, acidic fruits, citrus, until they are doing better. Then adding them back one by one to figure out what their diet should be as they go forward. Number 3, exercise. Exercise regimens will focus on low impact movements and exercises that include stretching as well as positive mind exercises, mind body medicine, right? Number 4, you're going to love this, pain care, pain meds. Standard pharmacological pain meds such as NSAIDs, acetaminophen, and urinary analgesics should be considered early in all patients. Let's not make them suffer. Let's get this pain under control early. Opioids. He says, as a general rule, opioids should be avoided over time. However, let's see here. Hold on a sec. I'll just read this to you. As a general rule, chronic opioids should be avoided as they not only denigrate the patient's own endogenous opioid system, which is your body's natural pain fighters, but also fail to provide pain benefit over time. In our experience, an opioid cessation program has included strategic use of cannabis, medical marijuana, which may not actually reduce the chronic pain of IC, but seems to help the patient cope better. I'll have to think about that. Psychology. For patients with psychosocial associations, recognition followed by psychological support will be helpful. And of course, that's very, very true. And as Danielle said earlier, we all have moments when we need extra support. We all have moments when we feel very dark. We feel very upset. We feel very hopeless. And we want to get you past that because there's always hope. And again, now that we're subtyping, wow, I mean, so many patients are getting better. So we don't think of IC as an incurable bladder disease. We think of IC as a pelvic pain syndrome. So we're past that step of telling patients, hey, I hate to break it to you, this is incurable. We're not doing that anymore. They talks about using GMSO. Yeah. Number 8, avoid a stepwise approach. Experience has taught me that for most patients, a stepwise monotherapy strategy is not effective. For most IC patients, a phenotype-based system multimodal therapy strategy offers the best pathway to improvement. And here's another one that's important. Managing associated pain conditions. It is imperative that pain outside of the pelvis, widespread pain or pain associated with IBS, fibromyalgia, chronic fatigue, back pain, be managed. This may require the assistance of a multidisciplinary team that may include yourself, a gastroenterologist, a gynecologist. Anyway, okay. Now, I will tell you, I chaired the State of California Pain Conference years ago because I'm bold. My favorite affirmation is, be bold, and mighty forces shall come to thy aid. And so I convened all of the affiliated pain condition support groups in Northern California, brought them all together in one room and said, hey, let's do a pain conference. And we did it. And we got the governor to sign the Pain Patients Bill of Rights. Ironically, when we did the pain conference, the head of the Bureau of Narcotics Enforcement, who I called and talked to, was a pain patient. And so you've got this, this legal authority. This job is to prevent the use of illegal drugs, who he himself needed pain care for his own chronic pain. And so my perspective on opiate medication is a little bit different than other people's because, I've been involved with a lot of that research and talked with a lot of the leading experts, et cetera, et cetera. Fighting pain is like fighting a fire. If the worst thing you can do is let it go out of control. And there are some of you who do that. You're like, you even have pain meds, you even have opiates, but you don't want to be perceived as a drug user. And so you wait until you're sobbing in pain to use it. But what you've done is you've allowed your nervous system to get more and more and more upset and involved. And so the key to reducing pain is to catch it as early as you can with the least amount of medication. So if you have a little fire in a little trash can, you can knock it out with a glass of water. But if you let that fire grow and it gets the drapes, and then before you know it, the half of your house is involved in flames, that's going to take a lot of water to get that out. And so one of the things that's very important for you to understand when you're having flares is you got to listen to your body early and act early. And learn about the different types of flares. You can have a bladder wall flare, you can have a pelvic floor flare, you can have a stress flare, etc. And we have, if you go over to the IC Network and sign up for our free newsletter, you can download our 40-page flare management guide, which has hour-by-hour rescue plans for each one. So I'm not against the use of opiates. I think, like, if you're recovering from surgery, things like that, there is a place. But taking opiates every day is the equivalent of chasing the symptoms. And that does create other challenges because, as he says in his article, you're actually suppressing your body's own pain management system, your body's own production of natural pain fighters. And so for the patients that I talk to who are doing that, I always ground that conversation back with, why are you in pain in the first place? Let's try to understand what's causing that pain. Let's try to understand what's triggering that pain. And it's so interesting that, when I start asking questions, it's like, well, where's your pain located? Well, down there. No, where down there? Well, down there. Where? Well, Jill, it's down there. No, that's not good enough. Is it on your skin, on the outside, or is it on the inside of your body? You'd be amazed at the number of patients whose skin is not in their bladder at all. It's in their vulva. Or the next question is, okay, well, if it's inside of your body, is it shallow or deep? Is it by your urethra or is it deep? And it's like, oh, never thought of it that way. That's pretty deep. Okay. Is it in your bladder? Is it in your vagina? Is it in your rectum? Oh, and again, you'd be amazed at the number of people who call me and they go, it's vaginal pain. And I'm like, oh, okay. You know? So anyway, I kind of rambled there. I didn't drink any water before I started this meeting, so my mouth is a little dry. In fact, you know what? I'm going to suck on one of my Xylomelt dry mouth. Definitely dealing with a little bit more dry mouth these days. And I'm not taking anything other than thyroid meds. This is cool because it will stick to your cheek for a couple of hours. Hold on. I got to get it in the right spot. Is that the right spot? That's the right spot. That's a sweet spot. Okay, now it looks like I have, does it look like I got chewing tobacco? Crap. Let me just chew it up. Danielle says, I take Advil like candy, but due to a past pill addiction, I'm on methadone, 70 milligrams, but even that doesn't take the pain away. I think that it'd be fascinating to try the palmitoyl ethanolamide, the PEA. It has a really strong record of reducing pain. It's been studied extensively with acute pain, chronic pain, fibromyalgia, burning mouth syndrome. You name it, they've studied it, including IC. We have a fabulous study with PEA and IC. It's a simple over-the-counter supplement. It's an endocannabinoid, has an endocannabinoid effect, and it's a fatty acid derived from eggs. Very, very well tolerated. It's what I take now when I need to. So that would be, Danielle, that'd be a very interesting piece potentially to think about. Let me write it. Hold on. Okay, now I got a piece on the roof of my mouth. That sucks. Ah. Oh, it tickles the roof of my mouth. Oh, there it goes. Palm says, what if you have a mild egg allergy? Well, it's not all derived from egg. There are other sources of PEA too. And honestly, I'm not sure. I'm not sure. I think you have to look at the source of the. I would go to the manufacturer of it and call them and say, "What's the source?" If it's from eggs, maybe you need to pass on that. All right. Lori said, "This has been my worst flare ever. I have an old prescription of pain meds. I have it if it hurts to sleep. My pain has been all over the place. You are spot on. My lasting pain is burning every morning when I urinate. Been 2 months of flaring. I never had the burning this long." So, Lori, you are an anatomical mystery to be solved. We need to try to figure out why you're burning. Are you burning because your skin is drier, because you have estrogen atrophy? Are you burning because there's something in your diet that you've gone back to that is triggering your bladder? Are you burning because you are a post-COVID patient? We're getting a lot of COVID cystitis now, patients. So your flare has been going on for 2 months. Did you have COVID in 22? Did you have COVID last fall? So a COVID flare is, for the most part, a cytokine storm. It's part of that massive inflammatory reaction that happens in the bladder. And you got to ride it out, hun. It's a 6 months, 3 to 6 months. For some people, it's 3. For some people, it's 6. Okay, you had COVID in 2020. Well, the COVID flare should start immediately post-COVID infection. So I think that it's probably not that. How about your skin? Oh, wait, or 2021? Well, getting closer. Did you have any bad colds last fall? Because you might have had COVID last fall, but you just thought it was a cold with all the RSV and stuff going on. Just you guys, you just have to remember that COVID is not a respiratory virus. COVID attacks your blood vessels. It goes throughout the body, and it leaves microscopic blood clots everywhere for many, many patients. And for some patients, end up with very, very big blood clots, and they end up, having a stroke or having they have to amputate a leg. In fact, you guys, one of my insurance brokers died 2 weeks ago, post-COVID. She was young. I was shocked. I called, I just had email from her like a month ago, 2 months ago. And she got COVID and she actually died in her sleep. So we are not over this. We all have to be smart. And that means you couldn't pay me to go to a movie. You couldn't pay me to go to a concert. And you couldn't pay me to get on a plane right now. If I did, believe me, N95 mask the whole way. Lori says, yes, you just got over a bad cold. Okay, so does one cup of coffee a day a real deal? Oh, girl, absolutely. Yes. If you're drinking 1 cup of coffee a day, your bladder will never heal. Never heal. The acid in the coffee destroys the next generation of cells. And that's from a National Institutes of Health lecture I attended, where they specifically talked about coffee and an injured bladder and how the bladder heals. Those little tiny stem cells in your bladder wall that are trying to repair it are destroyed every single time by that cup of coffee. So every cup you drink sets you back worth a 2 weeks worth of healing. So you got to lose the coffee for like at least 3 months, maybe 6 months. Lori says, yeah, that's what my son says. It's not like acid. It is acid. It is acidic. And the acidity is based upon where the coffee beans are grown. If they're high altitude coffee beans are much more acidic. They're low altitude, they're lower acid. High altitude, higher acid. The second thing we look for is how is it roasted. If it's roasted in a big metal hot drum, that produces more acids. If it's air roasted, that produces less acid. And then last but not least, it's how you brew it. If you use a cold brew method, that extracts less acid into your cup. If you use hot water, that extracts more acid into your cup. I've written articles on this. And so coffee is acidic. Judith says, so coffee is your enemy? It is the enemy to any wound. If you had a wound on your hand, would you pour coffee on it? Of course not. And what would happen if you poured coffee on it every single day? Would that wound heal? No. The wound would get bigger and bigger and bigger. It makes no sense to pour coffee on a wound. And for those of you who have estrogen atrophy and your bladder defenses are compromised, and or for those of you who have Hunner's lesions, your bladder has no defenses anyway. The acid's going to go right into the superficial tissue of your bladder wall or into the lesion. Judith says, how about peppermint tea? Peppermint tea is great. Go for the peppermint tea. Better yet, chamomile tea. Now, hold on a sec. Kayleen, I think you wrote something. I don't know if you're still here or not. Kayleen said, I have the endo doctor first week of February to find out why this pelvic pressure is back. I had an MRI on Friday for my back. It turns out that my SI or your S1 is so messed up. It's definitely gotten worse since post-op. It's probably what's hitting my pudendal nerve. Thank you. Answers. Finally, you're getting answers. And this is the perfect opportunity to help us all understand Kayleen has a serious spinal condition. Bladder therapies are not going to fix that. What's going to fix that is trying to understand the injury and working on the injury, right? All right, here, hold on. Sharon says, do you recommend trigger point injections? Everybody recommends trigger point injections. If you've got trigger points and they're not coming out manually, they need to, a trigger point's a muscle knot. And as long as you have a trigger point in that muscle will never be healthy, which annoys me because I have a trigger point here that I've had for 30 years since I got rear-ended and had whiplash. As long as you have a trigger point, it compromises blood flow. And I have a picture of that. Hold on. Let me just show you this picture because it will help you understand why it is so important to deal with trigger points. I actually talked to my doctor at Kaiser. It's like, or my physical therapist. It's like, is there anybody who will deal with this trigger point? Please, for God's sake, give me a trigger point injection. And they're like, no. Are you kidding me? Come on now. Trigger points are not normal. Here you go. This is a trigger point. These are trigger points right here, right? So what happens is this muscle fiber contracts and gets bigger. And look at what it does to the blood vessel down here. It now presses on the blood vessel. And now we're not getting good blood supply. Danielle, absolutely. I'm at the corporate office or the patient education line. But in the afternoons, in the morning, I'm doing elder care. Okay. Okay, so this is why trigger points are so bad. As long as you have a trigger point, you have compromised blood supply. There goes my tonsil. Son of a gun. Woo, needle in the tonsil. Woo. Let me go get a drink of water. I'll be right back. Oh. I challenge anybody to talk as long as I talk and not get these weird things. Okay. Yikes. Like having a needle stuck right in my tonsil there. All right. You know what? Can we just all just take a step back for a moment and take a deep breath? Let's just do a couple of deep breaths here. In and out. In and out. One more. In and out. I want you to think of, if you could look at anything that would put an immediate smile on your face, what would that be? Would it be sitting on the beach and watching the ocean? Would it be having a grandchild running towards you and laughing? What could you look at that would put an immediate smile on your face? For me, I'm going to say a warm, sandy beach with the sun shining down and the ocean waves. So I want you to close your eyes and I want you to visualize your happy place. What is your happy place? And go there. Let's just go there for a couple of seconds. And take a deep breath in and a deep breath out. That is part of I Spy. That's a great way of calming your brain down. Just relaxing everything, centering everything, getting into a nice, calm, happy place. If you could listen to something that would put an immediate smile on your face, what would that be? That was, for me, Kenny Loggins. Kenny Loggins. I was listening to it as I was putting my makeup on. Go there, close your eyes, and listen to your favorite song for a moment. He has a song, there's a wind in a something, something. Da, da. Anyway, I love that song. Go to your favorite song and just be there. I love John Denver, Looking for Space. And I'm looking for space and to find out who I am. And I'm looking to know and understand. It's a sweet, sweet dream. Sometimes I'm almost there. Sometimes I fly like an eagle. And sometimes I'm deep in despair. I love that. Anyway, deep breath in and a deep breath out. We're good. Sue says, I know you're sick of surgery, Jill, but you really need to get those tonsils out. They make your whole system. I know, girl. It's all COVID. I mean, the tonsillitis kicked in really maybe a year ago, a year and a half ago. I was thinking about that today, going, I'm probably going to have to have my tonsils taken out. And they say it's terrible when you're older. I was literally thinking about that. Phyllis says, what about Tyler's? Well, Tyler's and pH tests, I found one article that rated the acid level of all low acid coffees. And I know Tyler says the first no acid coffee, but that test showed 6.1 rather than 7, which showed that his coffee was still a little tiny bit acidic. I think the best low acid coffee on the market is actually Dandy Blend, which is an herbal coffee. There's no acid in that at all. Or Bella Rosa. We have Tyler's, we have Bella Rosa, we have Simpatico, and we have Tyler's in the IC network. So I'm not going to sugarcoat it. It's awful when you're older, but I had mine out at 21. I'm sure it's not as bad as it used to be. Well, I am 62. Lori says, I just got on. Have you been sick? I just have tonsillitis. I mean, it just comes and goes. I had it last summer too for 3 months or 2 months. It's part allergy, part anyway. My tonsils are just red, and we've swabbed them, and it's not strep. It's just viral tonsillitis or allergic tonsillitis. Donna says, how much PEA in Allopath? I don't know. Do I have it on the shelf? He doesn't break it down. These are proprietary formulas, so he doesn't break it down and say how much. You have to call the company. You know, a lot of companies now are using proprietary formulas, and I can't fault them for that at all. Renee said, when did you have COVID? I have not had COVID. I have not had COVID. And I thought I had it a couple times, but I always tested negative. And nobody, my parents haven't been sick. Remember, My life has been inside of a house for 3 years, caring for very, very elderly parents during COVID. So the only thing I do is I go walk, and I don't walk behind people usually, but I live out in the country anyway, so that's fine. And when I shop, I wear masks, and I just take them to the doctors. I do nothing else except do these meetings, and you guys are keeping me sane. Danielle says, sometimes singing does bring my pain levels down since I sing and play drums. Yeah, well, it's, Danielle, it's all about pain processing. When your brain is processing pain, it goes through 3 levels. So the pain message goes from your pelvis up your spinal cord. The first place it goes is to your lower brain, which is the gate. And all the gate does is send the most important pain message through. So the first defense you have against pain is distraction. If you step on a nail one day and 3 days later you fall and break your arm, you're not going to feel where you stepped on the nail. You're only going to feel the broken arm. That's the spinal gate. That's how your brain processes pain. And so slapping your thigh, creating another source of stimulation, doing this, you can do a trigger point here. That's another way of getting your brain to try to pay attention to something other than those pelvic pain nerves. Then at the midbrain establishes context. So it's your midbrain that goes back into your history and goes, have you ever had this pain before? Yes or no? And it tries to help you establish the importance of it. But one of the things that it does is it looks at your emotional state. So if you're crying while you're in pain, your brain goes, uh-oh, your life may be at stake. So your midbrain intensifies that pain because it's trying to get your brain to act to save your life. But if your pain is accompanied by laughter, your brain goes, well, she's laughing, therefore her life must not be at stake. And your brain will reduce the level of pain that you're experiencing. So that's what the midbrain does. And then the last part, the upper brain, is what directs action. And the book, there's a book that explains that is... By the way, did you guys see this? Did you see my new thing? Look at this. Is this not beautiful? This is an original watercolor. I bought it from an artist in England for 150 pounds because I fell in love with it, and it makes me happy. Okay. This book, When It Hurts Down There. So Danielle, you really should think about getting this book. I think it will give you a lot more tips on how to cope with what you're going through. Danielle says, if I may offer something of experience, when I was drinking Propel grape water, it was more acidic. I've been drinking pour for the past week, 7.4, noticed a bit of relief. Cool. You got to be careful with the alkaline water too, because alkalinity is just as bad as acidity. Your goal is to try to be neutral. W. San Marcos says, what can I take for bladder flare-ups besides water? Hunner's subtype, aloe vera did not work. The challenge with Hunner's is they're open wounds. And so you need to follow the bladder wall protocol, which means, number one, make sure you're drinking plenty of water to keep your urine dilute. Number two, you might want to consider urinary anesthetics. Obviously, diet is critical for you. And ultimately, we want to try to figure out what's causing your lesions. Are your lesions being caused by something out of position that's pressing on a nerve? Or are your lesions being caused by a viral infection? Because if it's a viral infection, then we want to perhaps use an antiviral. But if It's a nerve that's compromised, that's releasing substance P, which is damaging the bladder wall and causing the lesion. Then you need to try to figure out how to release that nerve, right? I've told this story before, but this was a case study published 1.5 years ago of a woman with severe bladder prolapse and severe Hunner's lesions. And when they went in to repair her prolapse, they found that her uterus was backwards. The back of her uterus was facing frontwards. The front of her uterus was facing backwards because the ligament had broken. So her uterus was swinging from one ligament. And when they repaired that, her Hunner's lesions healed completely. She's considered a complete and total cure. Jessica says, Allopath hasn't helped at all with the urgency of the burning. You're going crazy getting up every hour at night, no matter how much liquid I drink. Dandy Blend was a great recommendation. Okay, so Jessica, whenever we see that intense nighttime symptoms, we always go back to the day. We always go back to, is there something happening during the day which is provoking the bladder so much that it's keeping you up at night? And so when I started this meeting, I think before you got here, I was working with a patient who had exactly the same problem. Her nights were agony. She was in pain all the time, but she hadn't slept for a very, very long time. And it turned out she was an alcoholic and she was drinking cocktails at night. And that was the one thing. She gave up everything else but the cocktails. And that was a very difficult conversation. It was a 2-hour conversation that I had with her one night. It was challenging for her and it was challenging for me, but and that's extreme. And I'm not saying you're an alcoholic at all, but it would be like a cup of coffee a day, or if you take a multivitamin. Do you take a simple multivitamin, or are you drinking overly filtered water that's more alkaline water rather than it's acid water? So is there something during the day that you think could be triggering your symptoms a little bit more? Are you being perfect with your diet? Have you gotten rid of all coffee, all green tea, all black tea, all soda, all chocolate, all artificial sugar? Have you gotten rid of all of that? Because you'd be amazed at the number of you who have not. You're like, I'm not going to let IC rob me of that cup of coffee in the morning. And my answer back is, you have to think of it differently. Don't think of IC as a disease, and you're going to not let this disease rob you of something. That's the wrong way to think of this. You need to think of this as injury or trauma. If you have a wounded bladder, would you pour a cup of coffee on it? Of course not. Right? Judith says, are you saying to stop multivitamins? Yeah, for the great majority of patients, mass market multivitamins like Centrum and One A Day are actually quite irritating. We have to do a low acid multivitamin like Bladder Smart, which is a vitamin that I asked a company to make for us, which is a much lower acid. The problem with mass market vitamins is that vitamin C comes from citrus. It's the old discarded citrus fruit. And so if the multivitamin has vitamin C derived from ascorbic acid, then that's not for you. You need to have vitamin C derived from calcium ascorbate, which is much lower. Jessica says, I don't drink alcohol at all, what is the best water brand for IC? I drink Arrowhead. I drink Arrowhead too. Arrowhead's good. Arrowhead's good, hon. So then we got to look outside the box here. Okay, so you guys, let's see if we can help Jessica a little bit here. So Jessica, if you don't mind, let me ask you some questions that I normally do when I talk to patients on the phone, and let's see if we can try to figure out the landscape a little bit here. If you don't want to do it, that's fine. You can just say, I don't want to do it. But how old are you, hon? And how old were you when your symptoms began? Natalie says, what do I think about this? A friend took doxycycline and azithromycin that didn't work. Well, Natalie, obviously that person had an infection. Okay, so Jessica, you're 53 right now. How old were you when all this pelvic pain started for you? And Judith, you can get the low acid vitamin right on the IC Network website. There's only 3 on the market. And I'm very proud that I was actually the person who basically invented the concept of a multivitamin, a low acid multivitamin about 15 years ago. It was actually my idea. I wish I owned it. I wish I could say it's proprietary and I owned it, but tragically, I don't. It's called Bladder Smart Low Acid Multivitamin. Okay, so Jessica, you're 53 now. How old were you when your symptoms started? Like, was it in the last year, the last 2 years, 5 years ago, 10 years ago, 20 years ago? When did all of this begin for you? You were 21. Okay, interesting. So Jessica, so this has been a 30-year journey for me. I was 14 when mine started, myself. So take us back in time. Was there any event that you associate with the onset of your symptoms? Were you doing sports? Were you in a car accident? Were you a cheerleader? Had you just gotten married? Was there any event that you think began this for you? Danielle says, I gave up soda 2.5 years ago. I drink nothing but water, which is a bland life, but I figured after finding crystals in my urine, I went OCD and drink nothing but water. So that's how I hear you. I hear you. But there are a lot of different things you can do with water, hun. I have a separate website called the IC Diet Project, icdietproject.com. And there's a ton of recipes in there. How to make infused water, spa waters. And there are certainly things that you could do, like a Dandy Blend herbal coffee, which would be fine because there's no acid in it and there's no caffeine in it. So, but it's about rebuilding trust again. We have to rebuild trust in our body, and we do that with very slow steps. So I would, number one, try chamomile herbal tea, see how you do with that. If you do okay with that, I would do peppermint herbal tea, see how you do with that. Some people have GERD and they can't do peppermint, and that's okay. If you do okay with those, you can then go to a rooibos tea. We have it in the IC Network shop. There's a pumpkin spice rooibos tea, very neutral, very bland, not pumpkin-y at all. It's more caramelly. If you do okay with the rooibos tea, then you can try the herbal coffee, and then you can try the real, but low acid, real coffees. But you're trying to heal right now. I applaud you for what you've done, and I'm very, very similar. I think I've had 2 7-Ups in 15 years. I had a clearly Canadian last night, a little bit of sugar, but not acidic like 7-Up or Coke. So, all right. So Jessica says she's had chronic UTI infection since a child. Okay. So Jessica, number one, you have to understand back then that everybody thought that we all had chronic infection. The bladder only knows one language: frequency, urgency, pressure, pain. So everything feels like infection. A bullet wound would feel like infection. A stab wound would feel like infection. So when I was 14 and I could not sit through class, they also said infection. And I took a massive amount of antibiotics and it didn't fix anything. But I was also diagnosed with something called a urethral stricture, which meant my urethra was getting very narrow because my urethra, in hindsight, was being squeezed by tight pelvic floor muscles. So there, for patients, whose symptoms begin as a kid, we really look for trauma first. Now, there's always a chance that you could have a little fistula, a little tiny tube that connects your bowel with your vagina or with your urethra. That's always possible to have a little tiny birth defect like that. But they ideally probably would have found it. Usually for people in their teens and 20s, it's trauma driven. And again, it all feels like infection, but there's usually a different anatomical reason for those symptoms. You officially got diagnosed in 2001 when you were on a ton of antibiotics since you were a child. You know what would be really interesting, Jessica, would be if there's any way that you can get your medical records when you were a kid. It would be absolutely fascinating to see what the test results were. We have one research study that was done years ago of 50 women who had been on antibiotics for over 10 years because they had all been told that they had infection. And when they went back through their medical records, out of those 50, only one had consistent positive cultures. So again, back then, the assumption was anybody who had frequency urgency pressure pain had infection, because back then we thought that urine was sterile and only bacteria and infection in the bladder would do this. Oh, my neck is tight. So when was the last time you had a positive urine culture? When was the last time you got diagnosed with infection? Anytime in the last year? Last 2 years? Because the proof ultimately is in the test results. And one thing you could do is something called a next generation DNA urine test. And what that test does, it doesn't try to grow bacteria, it just looks for DNA. And if it can find bacterial DNA, it can identify it. It can also identify fungus. So there's always a chance, too, that you could have a fungal infection, candida, in your urine. That was found by our own National Institutes of Health. Next generation DNA urine test. I built a website on that called bladderhealth.org. You should go learn about it. It's $199. If you are absolutely convinced you have infection and you don't believe it, the proof is in the test result. Next Gen will find anything and everything. Last year, everything perfect since then. You have done the next generation. It's all good. Okay, that's good. Excellent. Excellent. So getting back to your question, you're getting up every hour at night with burning, no matter what. Have you gotten substantially worse in the last year or two? And have you had a hysterectomy or have you had COVID? If you've had a hysterectomy, if you've been on Lupron, if you've been on birth control that's suppressing your estrogen, that would affect your bladder wall. It would make your bladder wall more vulnerable. Oh, okay, girls. So you've had very bad COVID twice. When was the last time you had it? Happy Sunday, Alexa. Aging matters, the quality and health of your skin matters, but COVID affects the bladder, guys. COVID will affect the bladder. It's called COVID cystitis. It's proven in research. They documented it within the first month or two of the COVID epidemic. We have our own COVID cystitis study going on, and I see patients who get COVID. 25% don't notice no change. 75% of IC patients who get COVID notice a significant worsening of their IC symptoms. And for 25%, it's a very, very severe flare. So when was your last COVID infection? Thank you, Danielle. Hey, let me go get some ice. I'll be back. So again, we're waiting for Jessica. Oh, all right. So Jessica, I need you to go to our website, covidcystitis.org, covidcystitis.org. So this flare is probably a COVID cystitis flare. It means you're having a cytokine storm. And I just emailed all the top IC doctors, again, looking for new resources. And it's basically a severe flare that can last 3 months, 6 months, and then it's short term. It does resolve, but it just takes a lot of time. Sandra said, can a Hunner's lesion heal on their own, or do they always need fulguration? Sometimes they do heal on their own. Sometimes they do. Here, I'm going to go get some ice. I'll be right back. Jessica said, thanks so much, Jill. I wish new research can. Oh, girl, the research is hopping right now. We are in a very good, happy place right now with research on very, very good, happy place. I'm very happy with what I'm seeing. We've got some fantastic new clinical trials that are going to start shortly here in the United States and in Canada and around the world. We've got fabulous new articles that have just been released. I just haven't had time to write them. To summarize them on our website. I'm thrilled. I'm thrilled with where we are. I think I'm very, very encouraged, and I think you should be too. Okay, things are looking fantastic for us. Also, we did a big National Institutes of Health meeting last fall talking about the future of clinical trials, and everybody is, I mean, we now understand why all those old clinical trials failed. They failed because you can't put apples, oranges, and bananas in the same research study. There's diversity in the IC patient population. We have to respect that. We can't expect Hunner's lesion patients and pelvic floor patients to have the same response to treatment. Now that we have agreement and consensus that we're not all the same, we will now be much better at producing the right treatments for the right subtype. Things are fantastic. Alexa says, what do you use for your hair? It's growing fast and it's thick and healthy. I use, let me get it, this fantastic conditioner. Hold on. And it is growing fast, right? I mean, see how, I mean, my hair's a beast. It grows and grows and grows. Best conditioner on the market, my friends. Olive and avocado from Earth Science. Olive and avocado hair mask. This is incredible. Absolutely incredible. Sandra says, how often is it safe to have a hydrodistension with fulguration if you have Hunners? Well, that's a question for you and your doctor, because every time you're put under anesthesia, you're running the risk of the associated with anesthesia, and that's a problem. So I don't know of any published study that talks about how often you should do it. We also know that lesions do respond beautifully to lesion-specific therapy, like steroid injection or laser therapy. And if that's the case, you might only need one. Some patients only need one. Others might need 1 or 2 a year until we can get these lesions to calm down. Alexa says, where do you get it? You can get it on Amazon. I got it at a local store. And I use a Dove shampoo. Got to be really careful with shampoos too. And I only wash my hair twice a week. So Tabitha says, what do I use for dry mouth? I use the Stylomelts. They're expensive, but they last a long time. I mean, it's like $20 for one of these, but this bottle would last, well, for me, because I tend to chew them, which is a mistake. This bottle would normally last 2 or 3 months. So xylitol. Xylitol causes the production of saliva. So xylitol is great. The problem with xylitol is every body has its own limit. And if you go over that limit, it gives you the runs. And so there are some xylitols that I can't eat for or suck on, but these, I could do a dozen of these and it's never caused a problem for me. But we're all different. Okay. Hold on a sec. The name of this is Earth Science Olive and Avocado Hair Mask. And it's in the tube. It's not oh, it's leaking. Oh, that's water. I just used it this morning, so. Oh, it smells so good. Renee says, I'm a former hairdresser and your hair is gorgeous. I barely have hair. One of the blonde kids with really thin hair. My mom, it's interesting, Renee. My mom is 92. She'll be 93. She'll be 94 in 2 months. Okay. I mean, in 2 weeks. So I never saw my mother with long hair. Never. She always had it permed and short. Becky, no, it doesn't. And so with COVID, because she couldn't go to the hair salon, we have grown out her hair. Let me get my cell phone. You're not going to believe how beautiful her hair is. Hold on a sec. I told her this morning, I told my mom this morning, she's not a redhead, she was a blonde when she was young. I told her that I got my hair from her. I've got pictures of her hair now. You will not believe it. As I can't believe it. It's amazing how beautiful her hair is. Hold on. Ah, shoot. I don't know if you'll see that. Look at that. Can you see that? That is the hair of my elderly mother. It is amazing. It glistens in the sun. I never saw we never saw this growing up. She always had it permed and short. All the perm damage is gone. And this is her hair. And it looks like my hair, doesn't it? It really does. We're going through weird moments with her because she's very frail. There are times when at night when she's falling asleep that she hears somebody singing to her. And she asked me, "Do you hear that beautiful voice?" And it's like, "No." And it's a man. And they was just singing the other night, just how great thou art to her. And she kept saying, "What is this?" And I told her, I said, "Well, I think the angels are singing to you." Just comes and goes. Just started in the last couple weeks. It might be anemia. We have an appointment tomorrow with her doctor to see if her anemia is back. That's a symptom of anemia. But Danielle said, "Oh my God, I'm 49 years old and my hair is pulling out." Oh, well, girl, listen. I understand too that we always lose hair. We over a period of time, and Renee, it would be interesting to get your insight on that because I went through periods of time, especially if my thyroid got low, my hair fell out in handfuls. Like scared the hell out of me. So if my thyroid is super low, then my hair falls out. If my thyroid gets super high, something else happens. Becky says, "It's too bad." I know, right? Like literally, I never saw her with long hair growing up. Never. It's only been in the last 2 years. And it's stunning. It's stunningly beautiful. And you think about all those sweet elderly people in convalescent homes and they cut all their hair off to care for them. Mm-mm. Never. Danielle says, "My hair was always thick and curly. It's pure white. The picture you see, I have a." Oh, okay. So like I would love to, um, growing up as a redhead, I used to have little old ladies coming over and assaulting me by rubbing my hair, and it used to drive me crazy, 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 crazy. I couldn't stand that. And then I developed this fear of going to the hairdresser because I have this really mean old guy who said, "You never let anybody touch your hair but me. You never color your hair." And he scared the living crap out of me. And so I still have trauma from that. I've been going to the same hairdresser for 40 years now. Her name is Jill, and we're the same age. We're the two Jills. But I only go like I can go a couple years without going. and then I get sick of having long hair and I go cut it off again. Elmeron. So there are some medications also that you might notice that after you've had surgery, 3 to 6 months after surgery, you might start losing hair. And that's because the anesthetic, there's something about some anesthetics that actually damage hair follicles. So it's very normal to lose hair after surgery. You don't lose all of it, but you could lose some of it. What else? What's the other thing that you can lose? Oh, Elmeron, pentose and polysulfate, which is the only oral approved medication for IC. That's also associated with some hair loss. And once you stop the medication, the hair usually comes back. But of course, Elmeron's now associated with eye disease, so it's not that much of a big deal now. Bonnie says, does your mom still wash her hair? No, I do all of her bathing for her. She can't use her fingers. She can't use her fingers to touch a cell phone. She lost all of her tactility of her fingers about 20 years ago. So like literally, she can't touch a cell phone. She just can't do it. It's the craziest thing. So she can't wash her hair, and she also now cannot wipe herself using the restroom. Yes. That's now my job too. And it's not fun. Although it does leave for some very hysterical moments. Yeah, and it is beautiful music. And so it's like the angels, maybe her sister and my aunt and uncle are singing to her. They were in a church choir and they had beautiful voices. All right. Okay, so I hope you're all following me on Twitter because that's where I post stuff. Listen, I don't post a lot. I mean, if I have a new blog coming out, or Stacy who writes for me, if we have a new blog, I'll post it on our Facebook group. I'll post it on Twitter. I'll post it on Instagram, and I'll post it on LinkedIn. I've just joined Post. I'm going to try to get off of Twitter. Post and the Spoutable. Spoutable is the future. And so Spoutable is hopefully where we're going to start camping. But I put all the fast news stuff on Twitter, and I gotta tell you, there was a fantastic article on here. Hold on, let me get it. You know, for those of us with IC subtype 5 central sensitization, we're struggling with these multiple pain conditions. We now understand that this is usually driven by trauma. And trauma-informed care is a buzzword that is becoming more and more important in the last 10 years. Because trauma is real. And for those of us who have been traumatized, our life becomes this kind of puzzle about how are we affected by that trauma? Physically, mentally, and emotionally. But really physically, I look at it differently. I look at it as physically and neurologically. And my life has been such a puzzle for me. I just have this quest to, I want to understand why this happened to me. I want to understand why I didn't have a normal childhood and 20s. And of course, now I know why. I mean, now we know why, because I grew up in a neighborhood with a rapist and murderer, and I was one of his early victims, and I was attacked. Okay, as a kid. Okay, and that profoundly changed the way I lived my life. What I did not understand is how it changed me physically. And because that created a foundation for my central nervous system to always be scared. Right? So I had frequency urgency in junior high. I had vulvodynia in high school. I had uh, ovarian cysts in college. I had developed irritable bowel in my 20s. Then I developed all these crazy sensitivities. And then I had migraines. And then finally I had bladder pain in my early 30s and yada, yada, yada. And just wanting to understand the migration of that. Because when you're in the middle of that, you feel absolutely loony. And it gets very, very difficult to talk to people about it because people are like, well, what's wrong with you now? It's like every year there's something new going on. Well, now we understand that connection. Now we understand what's going on. And what's going on is we have a central nervous system that has been injured. It's called the central nervous system maladaptation. And there's really great news here because we know exactly what to do to fix it. I mean, why do I not have all this pain? It's because I have worked extensively on my nervous system to calm it down and also on my muscles. And so, but in the end, it all started with this trauma. And I was working with a patient, last week, same thing. She was, she was in her 40s. She was single. She was afraid to date because she was afraid of men. And I understand that because I was too. So, anyway, no shame, no blame. It happens. We have to understand the ramifications of it. We also have to understand that it's in the past and it's not going to happen again because we're strong bitches. We're going to make sure it's not going to happen again. But we still have to deal with the ripple effects. And so on my Twitter account, I linked this fantastic article I read last night from the Cleveland Clinic and the different types of trauma, how they can affect you, and what the steps are for healing. And this is an absolutely brilliant article. Whether it's from a prolonged abuse or a single effect, trauma can be addressed by working with a trauma-informed therapist as well as practicing self-care. But anyway, it explains the hows and the whys. Think of your mind as a sponge. Whether it's good or bad moments, our brains can hold on to a lot. That's why emotional trauma can stick with us long after a traumatizing event has passed. Sure, we've all had bad, downright embarrassing moments that stick with us. Maybe it's that time you spilled coffee on your way to work or when you just missed your flight that still keeps you up at night. But trauma is more than that. Trauma is a result of emotionally painful or abusive experiences, and it ranges from something like a physical accident to emotional abuse. The spectrum of what can generate a traumatic episode is quite wide, and so the process of healing can look different for everyone. Let me just read a little bit more and then you can go, because I think this is really good stuff. And this is stuff we've been talking about. Trauma is an emotional response that lasts long after an event occurs that causes significant mental or physical stress. Just like a physical scar from a deep cut takes time to heal, recovery from trauma is possible with time and treatment. And it's important to remember that ignoring or avoiding symptoms of trauma isn't a healthy coping response. In fact, avoiding them can make things worse. More on that later. So when you go through a traumatic event, your mind sometimes remembers how it felt and keeps that trauma response at the ready. But ironically, some people can't recall traumatic events. So in general, trauma affects two parts of your brain. The amygdala, this is your brain's emotional center. It's responsible for how you react to the good and the bad and everything in between. When trauma occurs, well, let's just say it starts to do its job a little too well. And so what can happen is that this part of the brain becomes overly aroused and is more hypervigilant to danger. For all of us, the amygdala is sort of our protection center, and it tries to keep bad things from happening to us. So it may start to ring false alarms because it's always looking for some sort of problem or danger around the corner. Now remember, what do we see in patients with chronic overlapping pain conditions? Their amygdala is on all the time. So this is spot on. The second part of the brain that gets affected is the hippocampus. The part of your brain that holds on to memory is also, of course, tied in with trauma. This is because your brain remembers how you felt when the traumatic event occurred. When your hippocampus is impacted by trauma, your brain starts to struggle between what's past or present, meaning that a memory of a traumatic event could start to feel like it's happening in the present moment. This is why certain experiences or triggers can set off a traumatic memory and put you in that fight or flight mode, even though there's no real danger happening. For example, that sound of an overhead plane can take a veteran with PTSD back to the fear they felt on the battlefield, or a loud crack of thunder may cause a hurricane survivor to feel that same intense anxiety they felt at the time of the traumatic experience. So even though it happened in the past, unresolved trauma can affect your present, causing things like panic attacks, depression, or an inability to go on with normal routines. And in some cases, you might develop complex post-traumatic stress disorder, which happens due to prolonged or repeated trauma over time. So how do you recognize the painful moments while also healing the emotional scars left behind? The first step is to give your feeling a name. It's trauma. It's not just a small setback that you can shake off or you need to feel ashamed about. It's something that becomes a part of your story. Let me just go on a little bit more. So there are different types of trauma, the big T and the little t. The trauma you experience doesn't have to look a certain way to be valid. According to Duke, trauma can sometimes be understood as a big T and the little t trauma. The difference between these two isn't really a matter of severity. It's not a competition over which trauma is worse, but rather how it affects your mind. Big T trauma is likely the first thing you think of when you think of trauma, like a large moment that can alter your physical or mental well-being. Big T trauma would be like a mass trauma and would certainly be a circumstance that most people, no matter who they are, would find traumatic. A good example of that is the fires that we go through here. Those are big traumas affecting, a couple 100,000 people where you're literally driving away because a fire is coming over the door. That's a perfect example of a big T trauma. Everybody where I live who lived through that has some PTSD. And when we hear the wind, and when we hear the planes going over, or we hear the TV talking about it, or God forbid, the alert, the evacuation alert over your phone, that's big time PTS trauma. So some examples of big trauma are natural disasters, violent attacks, military combat, sexual assault, or physical abuse. Little t trauma is complex in a different way. It may not affect everyone the same, and in some cases, the little t trauma can be harder to recognize or define. So examples of little t trauma include loss of a pet, a breakup, divorce, having to suddenly move, financial or legal troubles, or of course, the all-time favorite, bullying. What is traumatic to one person really might not faze somebody else. Bullying is a good example of little t trauma. Some people experience bullying as a child and they aren't fazed by it, whereas others can really relive being bullied as though it just happened. So she talks about childhood trauma, sexual trauma, relationship trauma, religious trauma, which is interesting, and then how to heal from trauma. And this is just something that I'm always working on, and I have to make an investment to keep working on it because, like this article says, the hippocampus remembers. So I will have memories that come back like that. And I've got probably the biggest memory that comes back over and over is this. I had this mean, almost evil boss in college, and he loved humiliating people, and I was a target of his. Um, and the first year that I was there, I was really good friends with his boss, so he didn't mess with me. He messed with other people. The second year, his boss was gone, and he started to mess with me, and I that was just really hard because he was cruel. And I know in hindsight it had nothing to do with me. He's obviously severely compromised in some way. But it's fascinating how your brain holds on to some of these memories. And what was interesting is I got a letter from them, the Alumni Vacation Center at UC Santa Barbara, where I was a tennis coach for two summers. And they sent me like 5 years later, they sent me a alumni letter, and I emailed them back, and I let them have it. I just said, this is the single worst employment experience of my life. I have never been so demeaned and so insulted and so offended and so hurt than I was when I worked for you. And I named names. I just let it out. And so they called me up, and they had the guy on the phone. They didn't prepare me at all. And I should have just chewed his butt out. How dare you? How dare you? How dare you treat any employee this way? What the hell is wrong with you? And I didn't do that. I was so stunned. It was like, oh, it's fine. No, it's not fine, because it still haunts me. 30 years later, 35 years later, 40 years later, it still comes up. And it's annoying that it comes up, right? So trauma-informed care, this is part of our journey, is we have to understand those traumas. Boreas says, I hit the bar on a child's bicycle as a kid 30 years ago. I swear it gave me, absolutely, hon. You sustained a pelvic injury when you did that. Very, very common. This is a very, very common trigger for pelvic pain and IC, is when your child hitting your crotch on the bar of a bicycle. I absolutely believe you. I don't think you were ever a bladder wall patient. You were probably pelvic floor driven back then. Sherry says, you'll never believe this, but I'm now in a new relationship after many years of singleness. Yes, girl. He's an old friend from my past. Anyway, I go to visit him in Oklahoma, in the country, for days at a time, and I get no pain. I think it's gravity-induced. Hold on. Gravity-induced pudendal neuralgia. As long as I don't lay down, I don't experience pain. I can't believe it. So I just try to stay active. But once I lay down, then I'm down for hours with severe pain. So Sherry, again, you're right. I see subtype 4 pudendal neuralgia using the pain system. Anytime your symptoms are that positional, that tells us it's muscles and nerves. Right? So if you have pain when you sit down, that gets better when you stand up, absolutely muscles and nerves. In your case, you're the opposite. You're fine when you're standing, but when you lay down, it hurts. And I hope that you will work with a physiatrist or an orthopedic surgeon to try to understand what's being compromised when you're laying down, right? Because something is shifting and pushing on a nerve. And we need to try to figure that out so that you can actually lay down, right? Renee says, what an ass. Yeah. Yeah, it's just unforgivable. I literally, I just can't forgive him for what he did. But that's what do they say? Forgiveness is how you release. I'm gonna forgive the fact that he was young and stupid, and he's an old man now, and because I'm an old woman now. But I sure wish it hadn't happened, and I hope he stopped. And I think that very blunt, honest letter I sent, hopefully stopped him. We'll see. Becky says, hi, I only typed half the sentence. My stepfather's grandmother had beautiful long hair until she passed. She wore braids wrapped in her hair. Yeah. We actually have my dad's mom cut cut her hair, and it was about this long. We still have that. For some reason, she gave it to my mother. And so my mother has this long, gorgeous piece of, I mean, it's really thick, of my grandma's hair. She cut it when she got married, and she gave it to my mom. It's in a box. So and so my hair is very similar to hers, only mine has blonde in it, where hers was brown and red. Mine is blonde and red. I know it's kind of weird, but it's what they did back then. Alexis says that one doctor told you you'd be a burden to your parents, and he was so wrong. Thank you, hun. Well, there always have to be moments in our lives where we rise to the occasion. The blessing here is, with each generation, we get to look at how we were raised, and we get to decide if we want to live that way or not. We have the opportunity to release the burdens of our childhood. We have the opportunity to change the future generations from dysfunctional patterns in past generations, right? I mean, it's just so important that, especially, obviously, I'm coming to the end of life for my parents. And listen, I had a wonderful childhood overall, very, very loving parents, but I get to live, like the house is brown and gold. Well, this is going to be my color tones, right? I want happy, cheerful, loving. But it is loving. It's just we all have to do our thing where we feel happy. The other thing I'm going to be doing is a lot of art. I love art. Like, the perfect vacation for me is a craft camp. Does anybody know any craft camps? Like, literally, just send me somewhere for a week where I can play with paints and I can play with fabric, whatever, crafts. So I'm going to be doing, hopefully, a lot of painting. I love painting, but I want to do big stuff. I just want to do colors. Colors make me happy. They make me very, very happy. And Donna, if you're watching, Donna, so this really funny story of my best friend from high school, Sheila. I went shopping. We didn't shop together. We have very different styles. So I found this incredible multicolored sweater, right? And it's just and it wasn't a rainbow, but it was like pinks and reds and yellows and greens and blues, and it was all stripes. It was Liz Claiborne. And I bought it. I love it. I loved it, right? And I went shopping with her the next week, and we walked by it, and she goes, "Who would wear that? That is so ugly." And then I showed up at her house the next night wearing it. It's hysterical. We laugh about it. But my wonderful friend Donna made this for me last year, right? Happy colors. Happy, happy colors. All right, guys. I know. I still tease her about it. We don't shop together hardly at all. We learned our lesson in high school. We've been best friends since high school. Isn't it? Yeah. Yeah. Very sweet, very kind. I have it right here. Isn't that pretty? It's so pretty. It makes me very happy. I don't want to live in a white and black world. I want to live in a world of colors. And I don't care what the colors are. Just give me something, like this. This is something that she gave me for my birthday last year. You make the world a better place. Right? But that's my style, right? Just like our logo, our new logo that we did a year ago. That's my style. Just happy. I want to be happy. Happy, happy, happy. All right. Well, guys, you listen. I can talk forever. I don't know if you want to hear me talking about Afghans or colors or hair. You got any more pain questions? I am happy to help anybody with any questions about IC and pain. This is a little bit of guava juice. Any more questions? Any more questions? Tabitha said, I just started physical therapy. What kind of wand should I look for? I know some vibrate, heat, and cool. Where could I find a good one to start with? Well, the one that I use is this one. Okay. So, and you can get it now from Desert Harvest. Desert Harvest bought the company. So it was called IC Relief. I think the glass ones are really good because they're really easy to clean. Super, super, super easy to clean with really hot water and soap. You can get them straight, you can get them curved, and they also have a longer one. I just got from our store, we had one unsold one that's a little bit longer for people that are a little mobility impaired, or they might be bigger and it might be hard to reach. So the advantage of this, here. Danielle, you still here, girl? How are you feeling? Are you feeling a little better? All right, so let us gaze at the anatomy of the pelvis, right? So here's the front of your pelvis, here's your pubic bones, here's your hip bones. We turn it around, we've got vertebrae, your spine, we've got your sacrum, which are actually vestigial vertebrae that are now fused together. We have the also important tailbone, right? I want you to look at everything that attaches to the tailbone. The tailbone, if your tailbone is messed up, your pelvic floor is going to be messed up. No doubt about it. And if we look at it internally, the thing you have to understand about your pelvic floor is that these muscles are quite flat. They're a little bit, they're strong, but they're thinner. And they sit just on top of the bone, right? They're sitting on top of bone. The challenge with these muscles and my perineum, this model, you have to attach the shallow muscles. You've got 3 different layers of muscles. So think about your knuckles. You've got shallow muscles, mid muscles, and then you've got deep muscles, right? So there's 3 layers of muscles going up into your pelvic cavity. The shallowest muscles are these muscles that I just put on. These are your levator ani muscles. And what makes a levator ani so unique in the human body is that they're the only skeletal muscles that also control major bodily functions, because they have, for a woman, 3 holes, and for a man, 2 holes. We got a hole for the rectum, we got a hole for the vagina, and we got a hole for the urethra, right? So if one of these muscles is super tight, what do you think it's going to do? It's going to squeeze the urethra. It's going to squeeze the vagina and squeeze the rectum. What does that mean then? That it's going to be hard to urinate. You're going to hesitate 5, 10, 15, 20, 30 seconds before you can release urine. You might notice that sex is painful. You might notice that you're more constipated because you can't relax enough to have a bowel movement. Hold on a sec. Sherry, we'll come back to that, okay? All right. So these are your shallow muscles, but let us now ponder for a moment. Now, what did I do with my wand? Where did I put it? Oh, there it is. So let us now ponder, how are we going to reach these muscles? Well, you're not going to reach them from the outside. So we reach them from the inside. So look, I have now stuck my finger through the vagina. And do you see how far I can get? I can get almost all the way to the top of the muscles. So when you work with a physical therapist, this is what they're doing. They're following muscle groups. We're trying to go the length of the muscle. Can you see this? See, I'm going the length of the muscle here because we're trying to get the muscle to release, relax, and flatten. That tight muscle lifts off the bone and it starts interfering with stuff. So what we're going to do is just gently relax these muscles. And normally you kind of, there's a bunch of different techniques they can use. Obviously, I'm not a physical therapist. We should have a physical therapist demonstrating. We just don't happen to have one here right now, right? But generally, this is kind of what they do. They follow the length. If they find a trigger point, they might rub on the trigger point. Sometimes they do strumming, where instead of going the length of the muscle, they go crossways, right? And you can see we have muscle here. So the best way to reach these muscles, obviously, is with a finger in your vagina and or a finger for men in your rectum, or even a woman. If you have more tension down by your rectum, they might actually stick their finger in your rectum just a little bit, try to relax those muscles there. I do that at home. If I'm starting to feel things are getting tight, I'll do that. I got no problems doing that. All right. But if you're doing it on yourself, you're not going to be able to get your finger in there in any great distance. And that is why we use a wand. And so let us look here at what the wand can do. So now we can use the wand to reach these spots and go the length of the muscle. It's a bit of an art. It takes a lot of practice to get it right. You got to learn from a physical therapist, do some reading. The book that really helped me understand these muscles is this one. When I first got a wand, I didn't know what the hell to do with it. Like, on it, I did not know what to do with it. I didn't. And so, she said, make sure you get a wand and start using it. And I'm like, okay, I got a wand. And I stuck it in there and I'm like, I don't know what to do. I literally didn't know what to do. I tried a couple of times. I just didn't know what to do. And so I went back to my physical therapist or I emailed her or something. And she said, Jill, it's a J shape. Just move it in the shape of a J, like this, right? Like a J, or like this, right? So I go back the next time I try it, and you got to work yourself up to it. It's not, you got to be in the right mood to do it with nobody else around and with your door shut and all that sort of stuff. Anyway, so then I was like, okay, and I tried to move it in a J shape, and I'm like, I don't get it. I'm sorry. Where's the J? I didn't understand the J at all until this book, Breaking Through Chronic Pelvic Pain, explained it to me, and now I can explain it to you. Okay. So the best way that I can explain it is visualize a line going from your tailbone straight down, okay? Your center point. You've got one J here, So here's the shallow J, and that's just, there's a short curve, and then you go the length of the J. And on this side, there's a short curve, and you go the length of the J. Now, if we look at it from the inside, the J shape actually makes total sense. Okay, so again, here's our center point. So we've got two J's facing each other. So here's one J here, straight up, and here's the other J here, straight up. So the J shape really works. And so you can do the J shape with a wand. It just takes a little practice. You're just, you do each side separately. You're going to work first on your left side and then on your right side. You don't go back and forth. Pick one side, work on it, and then the other side, work on it. And of course, ask your physical therapist for training and tips, etc. Now, some people, are you okay? Sorry. That's my mom, who's also dressed in pink today. Are you okay, Mom?
Yes, thank you.
Okay. The other thing that's that I find so interesting about working with my pelvic floor is that, so before my hysterectomy, so let me take a step back here. When I started the IC network, I could sit for hours and not have a problem. I would sit here writing stuff about IC, programming the IC network website. Well, what happened over time is it got more and more difficult for me to sit because I was just sitting too long and I was hurting my muscles and my nerves. And then one day I couldn't sit here, so I went into the living room and I sat on the floor. And I was still working on a laptop, and I worked like 12 hours that day. And I felt a buzzing sensation in my left butt cheek. And that was the first time that I compressed a nerve by sitting too long. Okay. But it was always on my left side. And so what happened is I went from being able to sit for 5 hours to 4 hours to 3 hours to 2 hours to 1 hour. And then a couple of years ago, I couldn't sit 15 minutes without pain. And the physical therapist that I was seeing kept saying, well, you have a muscle injury, just stretch. Well, believe me, you talk OCD, I could touch my nose to the ground. You want me to stretch? I will stretch for you. And I stretched for a long time. But the thing is it just got worse and worse and worse and worse and worse. Why? Well, it turns out that on my left side, so basically I abandoned the Kaiser physical therapy at that point in time for the sitting pain. And I went to a sports therapist because I was an athlete and I'm still an athlete, right? And so he's the one who went, Jill, it's your SI joint. The reason why your muscles are tight on this side, on the inside, is because your muscles are trying to stabilize the joint. Because I have an SI injury, and it's an injury from my sport. I was a tennis player, and I was a professional tennis player for a while. So this is what happens to tennis players: is you put all your weight on one foot, and then you turn and you twist the joint, and the joint gets weak. And so my physical therapist was actually the physical therapist for the Olympic team, the tennis Olympic team. And he said, I have the exact same injury that Yvonne Lendl had, right? So my pelvic floor muscles on my left side were just ungodly tight. And they were tight up high. It was the highest muscles, the piriformis muscles, because those are the muscles that are responsible for trying to keep that joint healthy. And so I was always working on the left side. But then I had my hysterectomy, and that changed things, because then instead of it being deep muscles, all my shallow muscles got very tender and very tight, especially on my right side. And so as I do my physical therapy, I first have to figure out what's hurting. Sometimes it's a piriformis on the left side and I go deep. Other times it's very shallow. It's these levator muscles. And in these cases, when I use my wand, I'm using it, I'm not going deep. I'm very, very shallow and I'm just working those muscles. And it works beautifully. It works really stunningly well. I want to have control over it. I need independence. I don't want to depend upon a physical therapist that I might only get to see for in 6 weeks to help me get a muscle out of spasm. If I can get a muscle out of spasm by using a wand, I'm going to get a muscle out of spasm. So you can get these last wands from Desert Harvest, desertharvest.com, because they bought the company. The wand that we carry now is this wand. It's a different wand. And this is a company that makes wands that vibrate. And this one is very valid too. It's very valid too. It has a really nice shape, slightly curved, might be a better shape. I like my last wand, but anyway, you can get this one on the IC network and it will do exactly the same thing, right? See this? See, and actually you've got a little bit more length, a little bit more flexibility. So this one actually might be a good starter wand. So anyway, you can get the last ones from Desert Harvest, or you can get this one from us, either or. Comes in a nice little bag here. See? These are all very easy to clean. How long does it take for the PEA to work? Renee is asking. Well, in the IC research study, by month 3, 87% of patients reported a significant reduction in their pain and discomfort and symptoms. By month 6, many were pain-free. And so I think 3 months is reasonable. Tammy says that Pure is helping her. Yeah, Pure helps me tremendously, keeping my nerves calm. So Sherry, what am I missing here with Sherry? Sherry said, Jill said several months. I always try to order it, but end up getting off of it. So I just need to make sure I order more before I run out. Well, we always have it, and we just got a new shipment. We've got everything now. So we got the bladder builders, the bladder rests, the Puras, the bladder smarts. We've got just about everything for the next 2 months before we start getting short again. So get it while you can. You know, all the manufacturing for all the supplements is very difficult right now. There's nothing quick happening anywhere. And sometimes production runs that prior to COVID took 6 weeks now take 6 months. So it's really important to stock up on things that you think are really helpful for you. Stock up, because they can't make promises to me, therefore I can't make promises to you. It sucks, but it is what it is. All right, guys. Well, I think we've come to the natural end of this meeting. So, number one, you were not alone. No shame, no blame. I want you to walk out of this meeting feeling calm, feeling centered, feeling strong, feeling hopeful, because really good things are happening. And sometimes what people need to hear from me the most is, I'm not scared for you. Because, you know, the vast majority, 99% of the patients that we end up talking to, they've got a classic presentation, either estrogen atrophy or pelvic floor injury or something like that. It's incredibly rare that there's something that is scary to me. And if there are, I tell them and we get them back to their doctor immediately. So This is a pelvic pain syndrome with a variety of causes, most of which are treatable, and many of these are fixable. And so stop chasing your symptoms, focus on cause. Doctor, why do I always have this pain in my vagina? What could this be? Why do I have pain when I urinate? Why does my urine feel hot? Why is sex painful? Why is sitting down in a car painful? Why does it hurt when I sit down, but it gets better when I stand up? Right? Those are the types of questions that we need to ask. And if you have pain in one location, we always have to understand that location because that's not typical IC. I was working with one gentleman struggling with quote unquote IC for years. And I'm like, okay, where's the pain? He goes, by my left hip. I'm like, wait, say that again. Where is your pain? By my left hip bone. Dude, that's not your bladder or your prostate. He's like, what? And I'm like, no. Your bladder is immediately above your pubic bone. That's where your bladder is. You're describing either muscle pain or joint pain. That is not your bladder. Nobody had ever told him that. And that's where his pain had always been, by his left hip. What the hell? Why are you telling him he has a prostate or a bladder problem? Clearly, he has either a hip problem or a muscle problem. And so if you have pain that always is at a certain location every single time, you need to get your doctor to study that location. What lives there? What structures are there? And for those of you who have pain on the outside, we need to look at the quality and health of your skin. That's not IC. The classic symptom that there's something wrong physically with your bladder is pain as your bladder fills with urine that is relieved by urination. The fuller you get, the worse you feel. But once you empty your bladder, you usually feel better. So the question now is, what the hell is that? Well, that can be multiple things. That could be a Hunner's lesion. That could be estrogen atrophy. That could be a chronic infection. Or that can be ischemia from tight muscles. That you have muscles so tight, they're squeezing blood vessels. Thus, your bladder's not getting the oxygenation and nutrition it needs, and the bladder wall starts to break down. That's why pelvic floor patients end up with bladder symptoms. But you can be on bladder treatments for years and never get better. Why? Because it's not fixing the underlying problem, which is poor blood supply from very, very tight muscles. Tabitha says, I've got that book. I need to get to reading. Yeah, it's a great book. Will you be getting more white chocolate drink? You know, they were massively out of stock and they had discontinued a bunch of stuff. So I think we got the white hot chocolate in. Let me look. You know what? I don't want to look on this computer because I'm streaming on this computer. Let me go over to this computer. Nope, we're completely out, hun. We got nothing. There's no white chocolate to be had. So Harney and Sons, no. What company makes it? Stevens Gourmet. I think they got bought by another company, and they canceled the peppermint and the cookies and cream. No, they canceled the candy cane peppermint hot cocoa, but they still have the cookies and cream hot cocoa, I think. Well, they canceled a bunch of stuff. We've tried to reorder. We just haven't had any luck. Stevens Gourmet, you can Google it, Stephens. Maybe you can get some from the company. Let me look. Now I've done long walks the last 4 days. Should I do a walk today or should I rest my body? I feel like my throat's saying don't go out in the cold. Yeah, it's owned by Indulgent Foods now. And let's just see here. We did get all the carob candy in, guys. If you miss your chocolate, carob is the way to go. We've got carob chips. We got a lot of carob now, and it's fantastic. If you need that little sweet thing. Okay, well, they still have white hot chocolate on their website. But that's all they have. They don't have any other white chocolates. And they say it's in stock, so I'll have my staff try to order tomorrow. I'll send them an email. Gay says to rest. I should. We all got to be good. Any ideas for dinner? What should I make for dinner? What should I make for dinner? We had fish tacos last night, but they were too spicy. Too spicy for my dad, and my mom ended up having to get up several times last night. So I need something simple and not spicy and not salty. Any suggestions for me? What could I make my elderly parents for dinner? What would be good? I could make ham tetrazzini. Ooh, that might be good. Ham tetrazzini. I've got sliced turkey. I could make. You guys ever make the? You saute chicken breast, and then you put cream of mushroom soup in there, and maybe a little bit of sour cream, and then so it's a chicken broccoli pasta, right? So you saute your chicken breast and you put cream of mushroom soup, maybe a little bit of sour cream, maybe a little bit of cheese. And then you cook your pasta, and like 5 minutes before the pasta is done, you put broccoli in that. Then you mix it all together in the cream of mushroom soup, and it makes this really yummy, good. That I like one pot meal, something that'll last a couple of days. I've been making a lot of white chili with hamburger, navy beans, zucchini, mushrooms, with a little bit of garlic and a little bit of ketchup because I can't use tomatoes for my dad. Cream corn, that's a winner. Meatloaf, that's a winner. Meatloaf with mushroom gravy is my mom's favorite. Mashed potatoes, mushroom gravy, meatloaf. I don't know. We'll see. I'll go see how cold it is. See if it's cold, I won't walk because I don't want the cold going into my throat. So, all right, guys, I will see y'all later. Again, I always try to do drop-in meetings on Facebook, but if I'm really busy, and I was really busy this week doing coaching, I can't do it, but I will try. Otherwise, you will see me hopefully next Monday. Knock on wood. Knock on wood. Be well. Have a fabulous, wonderful week. And please remember, you have never been more prepared to deal with whatever happens to you than you are at this very moment, because you are truly one day older and one day wiser. I like to say we're tough, strong bitches in the best possible way. I apologize if that offends anybody, but that's how I feel. All right? Okay. Be well. We're going to say goodbye to YouTube first. See you later, YouTube.